You're watching America Trends. I'm Mary Burt-Godwin, and we are starting Mental Health Awareness Month. And it comes up a lot on this show, and I'm happy to be a platform where we can talk about mental health and things to look for, ways to help it, all the different things. And I am very excited to welcome our next guest. He is a pediatric intensive care physician, pediatric anesthesiologist, a professor at Stanford University School of Medicine, mindfulness expert, and the author of Gain Without Pain, the Happiness Handbook for Healthcare Professionals. I'm very much looking forward to meeting you. Dr. Greg Hammer, welcome to America Trends.
Wonderful to be with you.
Yes, I was just going over your resume and thinking, oh my gosh, it does not end, all the amazing things that you do. And I really am honored that you are taking time out of your busy day to speak with us about some really important topics. And Stanford's very near and dear to my heart because that's where my dad went. So I love Stanford. And so you have been, how long have you been a pediatric intensive care physician?
For the past 35 years.
Wow, okay. And then when did you segue and or add in the mindfulness expert part of your career?
Well, I've always been a fitness enthusiast in the broad sense of the word. That is spiritual fitness, physical fitness, and been studying Advaita Vedanta for the past dozen years or so. And then Stanford convened an organization called WellMD. They're really out ahead of the curve. It's a wonderful university and always innovating. And in the medical school, that's as true as it is in the university at large. So an organization was convened called WellMD, and this was done in response to the growing prevalence of burnout among physicians. And so I joined that and have been very committed to pitching into the cause ever since. I was invited to give a talk at a national meeting on wellness and burnout and the remedies for burnout, and then another, and then another, and then I had some sabbatical time, so I decided to write the book, and it did quite well, so we're still talking about it.
Well, I was going to ask you, was it specific to the COVID time, or was that burnout even before COVID? Because I know certainly COVID just ramped it up 10 notches.
Absolutely. It did. And I wrote the book before COVID started. It was published in May of 2020.
I saw that. Yeah.
Timing was fortuitous, I suppose, in that respect. But yeah, no, the book was really written before the pandemic started. But as you know, there are so many other things that are driving burnout, not just among healthcare professionals, but among everyone. And, the pandemic certainly had a huge impact on our culture and levels of chronic stress. But there are other factors that are always ongoing. And then I think even in particular, a number of issues over the last 5 years or so, or perhaps a little bit longer, with our political divide, just general animosity in our society, gun violence.
What about the digital? Sorry to interrupt you, but I was also thinking to add to that too is the digital revolution, the technology revolution, and social media, the fast-paced world in which we're all living in, the pressures of everyone can reach me at all times. There's no downtime, and the rise in mental health issues with our youth. Does it relate to social media? We don't know. It's a lot of different things, right?
Oh, I absolutely think social media contributes. In fact, the book I'm writing now is called A Mindful Teen, and it's really geared toward teenagers, not as an audience, but as a subject. The audience would be parents, teachers, school administrators, counselors, et cetera. But yes, my co-author and I have really done a deep dive into all the things that teenagers face. Social media is a part of it for a number of reasons. There's bullying, there's sort of self-shame and constant sort of image comparing with comparing with others. There's the question, should I wear a bulletproof vest to school today? What is my sex and gender?
Right.
One could go on and on. Why are my parents always arguing about politics? And
Yeah.
Or why are my parents arguing with others in the family when we get together and we end up leaving early? I mean, you could just go on and on.
Well, I would like an early copy of that book, if I may, because I have two teenage daughters, 14 and 16, actually almost 15 and 17, and I am in the throes of this world. And, you know, the time limit I put on their apps on their phones, what is it doing? You know, do you have 2 hours, 5 hours? I don't know. They are very active in their life, but I was just with my girlfriends from college. We had a little mini reunion, and we were talking about this concept of how, because I think out of the four of us, 2 to 3 of them have kids, teenagers that are on some sort of anti-anxiety, anti-depression medication. And we were talking about this, the prevalence of it, and we thought, well, gosh, in our day, we just like turned on the radio and cried in our beds, and then maybe went to parties and drank too much, or, you know, did some behaviors that weren't very good to numb whatever we were feeling. But we didn't have words like anxiety and depression, I don't think, back then, as much as it is now. But we also didn't have social media. So are you finding a big difference of, like, you know, the generations?
Oh, absolutely. I think, you know, you and I are probably in different generations, but the fact is that neither of us had any of these issues when we were young, when we were teenagers. You know, we didn't have the social media, obviously, at least I didn't. But also, you know, the country was not quite so divided as it is now. There's just, you know, you can't get away from it. And and one thing I think that's driving, in some part, it may be a small part, but I think that AI is actually driving us further apart, because people are hooked on their media, and the content of their media is really driven by AI. So we're always getting information pushed to us,
Yes.
with which we agree that we're going to tend to want to absorb more of and hang in there and, you know, see the ads or whatever. You know, it's all driven by commerce and by money, unfortunately. But I'm very worried about what's happening with AI from a number of perspectives. But one of them is I do think it's actually driving us further and further apart. And we certainly didn't have quite this much animus in our society when we were growing up.
Right, we didn't know if our aunt or uncle, I mean, maybe the rare occasion, but we didn't know teachers, friends, siblings, how they stood on these political issues. But now you know, because everyone posts about it on social media, and people are just more vocal about it. And it was like, you know, the big topic, you don't talk about politics and religion. You just all get along in the sandbox, and you can have your own freedom of your thoughts, but like, don't push it on us. But now there is that fighting all the time on social media that can contribute to that anxiety. I definitely saw that rise in my own life, you know, in the last few years.
Absolutely. Well, this is why I wrote the book, in part, and the GAIN in capital letters in the title is an acronym for gratitude, acceptance, intention, and non-judgment. And I think those are really the 4 pillars of spiritual well-being, emotional well-being, and resilience. And partly what we're discussing right now is the A in GAIN, which is acceptance. So as the Serenity Prayer would have it, we need to discern between what we can change and what we cannot change, and accept that which we cannot change. And let's face it, we're not going to change each other's minds very much.
Right.
And so let's focus on acceptance. Let's be grateful for the loving kindness and the company of our friends and the love we share with our friends and family. Let's be grateful for that. Let's start with that. And then we move to the A in GAIN, which is acceptance. So if we have different opinions, well, we've just sort of gone through our gratitude for having these loving people as friends and family. So now we need to move to acceptance of our disagreements. And that's okay. There's nothing wrong with having different views, of course. It's really how we react to that. And yes, I agree with you fully that we're moving in the wrong direction with regard to acceptance. There's more and more resistance.
Yeah.
There's a formula in the book: suffering equals pain times resistance. Suffering equals pain times resistance. So the pain might be the hurt of our disagreements, and the resistance is pushing back. If we accept rather than resist that other people have different ideas, our suffering in our relationships and to our amongst ourselves personally will diminish. So let's learn to open our hearts and be accepting.
I love all of this. I knew I was just going to love this conversation with you. And I am actually in a program of recovery myself that practices the Serenity Prayer. I practice gratitude daily. I learn a lot of these tools of acceptance. They're challenging, hard work, though. And I think that one concept I was going to dive into is this the concept you were saying right here about pain and resisting it is that I feel like, I was mentioning the bumper sticker that says no bad days, where we have this feeling in our society that we can't have a bad day or we can't be sad, we can't feel grief, when actually they're not happiness. You can still feel grief, but not have depression or anxiety. We want to walk through the sadness and the grief and not be afraid of it, or like you said, resist it, be in acceptance that it's happening. So I want to dive deeper into this. Do you have time to stick around for one more segment with me, doctor?
I'm fine. I've got time. I'm actually on sabbatical and I'm at my home in Carmel. You can see Monterey Bay
It's
behind
beautiful.
me, so
I'm very jealous.
I'd love to spend more time together.
Okay, wonderful. Dr. Greg Hammer, Pediatric Intensive Care Physician and mindfulness expert. I am so excited to have this conversation. Stick around for more America Trends with Dr. Greg right after this.